Now, did you know that approximately 1 in 3,000 pregnant women will be diagnosed with breast cancer? An alarming statistic that brings us to today's discussion. In the grand scheme of life, pregnancy is often a joyous occasion, a time of anticipation and preparation. However, for a small percentage of women, this joy can be overshadowed by a diagnosis that no one ever wants to hear: breast cancer. It's a rare occurrence, but one that can bring a whirlwind of emotional distress, fear, and uncertainty. Pregnancy often brings about a myriad of changes in a woman's body, and the breasts are no exception. They grow larger, become tender, and may even form lumps due to hormonal shifts. These normal changes can complicate the detection of any abnormalities, such as those caused by breast cancer. It's like trying to find a needle in a haystack, with the haystack constantly changing shape and size. This challenge does not mean detection is impossible. Instead, it emphasizes the need for vigilance and awareness. It's crucial to understand that while these pregnancy-related changes are natural, they can sometimes mask the early signs of breast cancer. Under these circumstances, healthcare professionals must rely on specific diagnostic tools to differentiate between these normal pregnancy changes and potential warning signs of breast cancer. This reliance underscores the importance of regular checkups and open communication with healthcare providers throughout pregnancy. Understanding the challenge of detecting breast cancer during pregnancy, healthcare professionals rely on specific diagnostic tools. Ultrasound scans and mammograms are the primary tools used to diagnose breast cancer in pregnant women. Now, let's delve a bit deeper into how these tools work and why they are the preferred choice for diagnosis during pregnancy. Ultrasound scans, or sonograms as they are often called, use high-frequency sound waves to create images of structures within the body. When it comes to detecting breast cancer, ultrasounds are especially useful because they can distinguish between solid masses, which could potentially be cancerous, and fluid-filled cysts, which are usually benign. In the context of pregnancy, ultrasounds provide a safe means of examining the breast tissue without exposing the mother or the baby to radiation. Mammograms, on the other hand, are a type of X-ray, specifically designed to examine breast tissue. They can identify changes in the breast that could potentially be indicative of cancer, even before a physical lump can be felt. However, the use of mammograms during pregnancy requires careful consideration due to the minimal amount of radiation involved. When needed, techniques such as using a lead shield to protect the abdomen can be employed to minimize any potential risk to the baby. Now, you might be wondering why tests like CT scans and bone scans are not typically used in these situations. The reason lies in the fact that these tests involve significantly higher levels of radiation, which could potentially pose risks to the developing baby. Therefore, they are usually avoided unless absolutely necessary. Once diagnosed, a range of treatments are available to ensure the health of both mother and baby. Remember, the goal is to effectively manage the cancer while causing the least amount of disruption to the pregnancy. It's a delicate balance, but with the right tools and expertise, it's achievable. Treatment options for breast cancer during pregnancy are carefully selected to avoid potential harm to the baby. In this complex intersection of life and health, many factors come into play. The type of treatment, its timing, and how it might affect both the mother and the unborn child are all crucial considerations. Let's delve into the various treatment options and understand them better. Firstly, we have surgery. It's often the initial step in treating breast cancer. In most cases, surgery is safe during pregnancy and doesn't pose significant risks to the baby. The type of surgery, whether it's a lumpectomy or a mastectomy, depends on the size and location of the tumor, as well as the stage of pregnancy. Then we have radiotherapy. However, this treatment is usually not recommended during pregnancy. The high-energy rays used in this treatment can harm the baby, especially in the first 2 trimesters. Therefore, this option is typically postponed until after the baby is born. Next, chemotherapy. This treatment might be necessary, but it's usually delayed until at least the 2nd trimester, around 14 weeks into the pregnancy. The first trimester is a critical period for the baby's development, and chemotherapy could potentially cause harm. However, From the second trimester onwards, certain chemotherapy drugs can be used safely without posing significant risks to the baby. Hormone therapy is another potential treatment, but it's generally not used during pregnancy. Hormones are critical for the baby's development, and therapies that alter hormone levels can affect the baby. Similarly, immunotherapy and targeted cancer drugs are usually administered only after the baby is born to avoid potential risks. It's important to note that each treatment option has its own set of considerations in relation to pregnancy. The health and well-being of the mother and the baby, the stage of the cancer, the stage of the pregnancy, and the potential impact of the treatment on the baby all play a role in deciding the best treatment course. It's also important to mention that medications for controlling sickness and pain during treatment are available and safe to use during pregnancy. Managing these symptoms effectively can make a significant difference in the mother's comfort and quality of life. Lastly, it's worth noting that the choice of treatment may not only affect the mother's health, but also other aspects of the pregnancy. This includes the timing and method of delivery, and the possibility of breastfeeding after treatment. The choice of treatment may affect other aspects of the pregnancy, including delivery and the possibility of breastfeeding. The timing and method of delivery will depend on the treatment plan and due date. When it comes to delivery, the treatment plan for breast cancer can have significant influence. Each case is unique, and doctors must consider several variables before deciding on the best course of action. For example, if a woman is undergoing chemotherapy during her pregnancy, the timing of delivery may need to be coordinated with her treatment schedule. This is to ensure that the baby is not exposed to chemotherapy drugs around the time of delivery, as these drugs could potentially harm the newborn. The method of delivery, whether a natural birth or a cesarean section, is another consideration that is influenced by the woman's treatment plan. In most cases, the method of delivery is determined by obstetric indications rather than the breast cancer itself. However, certain treatments might necessitate a particular delivery method. It's essential to have these discussions with your healthcare team, weighing all the pros and cons to make an informed decision that's best for both you and your baby. Now let's talk about breastfeeding. Breastfeeding after breast cancer treatment is a complex issue and depends heavily on the type of surgery and whether cancer drugs pass into breast milk. After certain types of surgery, such as a lumpectomy or mastectomy, breastfeeding might not be possible on the affected side. Additionally, certain cancer treatments can also affect the ability to breastfeed. Specifically, if you've received chemotherapy, while it's typically safe to breastfeed once the drugs have cleared from your system, it's crucial to discuss this with your healthcare team. Some targeted therapies and hormonal therapies may pass into breast milk, potentially posing risks to the baby. Again, a thorough discussion with your healthcare provider is necessary to understand the potential risks and benefits. Remember, every woman's situation is unique, and what works for one might not work for another. Your healthcare team is there to guide you, providing personalized advice based on your specific circumstances. Coping with breast cancer during pregnancy is a journey that requires substantial support. Navigating through this challenging time calls for significant support from healthcare professionals, family, and friends. In the face of such a daunting journey, the importance of a strong support network cannot be overstated. It's not just about the practical aspects of managing a diagnosis and treatment plan. It's also about the emotional resilience that can be drawn from knowing you're not alone, that you have people who are rooting for you, standing by your side, ready to lend a helping hand or a listening ear. Healthcare professionals play a critical role in this network. They provide the medical support needed to navigate the complexities of breast cancer treatment during pregnancy. They are the ones who will guide you through the minefield of decisions you'll have to make, offering their expertise and advice to help you make informed choices. They will be with you every step of the way, from diagnosis to treatment to recovery. But medical support is just one piece of the puzzle. Emotional support is equally important, and that's where family and friends come in. They are your cheerleaders, your confidants, your sources of comfort and strength. They can help you deal with the rollercoaster of emotions that can accompany a cancer diagnosis, providing a sense of normalcy in a situation that is anything but normal. The power of emotional support during this time can't be underestimated. It can help reduce stress and anxiety, improve mental well-being, and even enhance the body's ability to heal. It can make an enormous difference in the overall well-being of both the mother and the baby. And let's not forget the importance of self-support. Being kind to yourself, taking time for self-care, and acknowledging your own feelings and fears are all crucial elements of navigating this challenging time. Self-compassion can go a long way in boosting your resilience and helping you cope with the challenges ahead. So let's celebrate the healthcare professionals, family and friends who provide this invaluable support. Let's acknowledge the strength and courage of the mothers who are fighting this battle. And let's remember the importance of self-care and self-compassion during this challenging time. Awareness and regular checkups are crucial in early detection and treatment of breast cancer. While breast cancer during pregnancy is rare, it's important to be aware of the risks and take proactive steps for early detection. The power of prevention cannot be overstated. It's akin to having a shield and a map in an unpredictable battlefield. Regular self-examinations and medical checkups are crucial for detecting any abnormalities early. They are the map, guiding you to notice any changes that may require professional attention. Now you might be thinking, why worry about something that's rare? Well, it's not about dwelling on fear, but rather embracing the power of knowledge. Knowing the signs to look out for and taking the time for regular self-checks allows you to take control of your health. When it comes to breast cancer, early detection is the key. It's the difference between a small, localized issue that can often be effectively treated and a more serious, widespread problem. The earlier the detection, the broader the range of treatment options, and the greater the likelihood of a positive outcome. It's also important to remember that pregnancy causes changes in the breasts, which can make it harder to detect abnormalities. This is why an open dialogue with your healthcare provider is vital. Ensuring you have regular checkups during your pregnancy can help to distinguish between normal changes and potential concerns. Let's not forget that the power of prevention extends beyond the physical. It's also about mental well-being. Knowing you're taking active steps for your health can provide peace of mind, reducing stress and empowering you to focus on the joy of your pregnancy journey. Remember, your health is in your hands. Prioritize regular checkups and stay aware of your body. By harnessing the power of prevention and early detection, you're not only taking care of yourself, but also creating a healthier future for you and your baby.